Alright, in this video we're going to talk a little bit about acute knee pain, or more specifically, how do we target an acute or sensitive knee with respect to our exercise prescription. Now we do want to start with a little bit of context here, and as we've talked about many times in the past, when treating musculoskeletal pain, especially acute pain and injury, one of the first things we need to do is develop tolerance to basic movement. So I think of it this way: if the knee cannot access and perform basic motions like flexing, extending, or rotating, that knee is going to either hurt all day, or movement is going to have to be significantly altered by the nervous system, as the brain needs to find an alternate movement strategy to avoid those painful movements or painful positions. So when dealing with a painful knee and a sensitive knee, the first thing we want to do is work on developing tolerance to these basic fundamental joint motions. And what I'm going to review in this video is my basic go-to movement sequence that I use for these painful, sensitive knees. Now with that said, let's go over the movement routine itself and look at the 3 specific exercises that are going to make up the routine. Then once we've covered the exercises themselves, I'll wrap up the video by discussing some key programming and progression criteria. That's when we're going to talk about some key things like how many sets or reps the patient or client needs to perform, how often they should be performing the routine, what's okay and what's not okay as far as symptoms that they may experience during the exercises, and then we'll also talk about how we know when it's time to progress the patient or client onto the next phase of care. And just as one last FYI, remember, if you are a My Rehab Connection subscriber and you use our exercise prescription software, you can find all of these exercises in our exercise library. You can either search for them by name in the exercise library itself, or you can find the movement sequence in the exercise group section under the title Basic Knee Movement Sequence, Pain Mobility Focus. All right, now let's take a look at the exercises themselves. All right, so the first exercise we're going to look at is our seated knee rotation mobilization. Now, this is really one of the critical movements and exercises we want to target here. We often think of the knee as this hinge joint that has to flex and extend, which it does. But rotation of the knee is really one of these absolutely critical motions, especially when we're dealing with pain and symptoms around the joint itself, maybe in the outer meniscus or into the ligaments or the joint capsule that surrounds the knee. In fact, if I see 10 knee cases, I would say 7 or 8 of them have a deficit in knee rotation. So this is an absolutely critical motion that we want to target. And how we're going to do that is just from a seated position. And I like the foot to be able to slide on the floor. So I'm using my little slider disc here, but if we had a sock or even a towel between my foot and the floor, that would accomplish a similar thing. Now, rotation of the knee is we're trying to promote rotation of the tibia on a stable femur. So the idea is we want that tibia to rotate back and forth under the femur. So to help with this, what you're going to do, and to minimize motion of the femur and of the hip itself, we're going to stick something between our knees. A yoga block or a ball will work fine, but even just squeezing the fist just lightly will help to lock this thigh in place. Now to perform the exercise, I'm going to rotate my foot outward, hold for a moment, rotate my foot inwards. So again, I want to make sure that motion is happening at the knee. So we're trying to rotate the tibia back and forth. Now what most people will do with this is they're going to want to pivot from the heel, which really promotes more motion at the ankle and through the subtalar joint. So the other key thing here is as I'm rotating, I kind of want my heel to go in while my toes go out, and then opposite. My heel goes out and my toes go in. That's going to help to get the tibia and the fibula rotating more so, as opposed to just at the foot and the ankle. And the other thing I really want to do here is I want to try to keep my foot as flat as possible. Again, we want motion to be at the knee. The foot is our leverage to create that, but we don't want the motion to be focused at the foot and the ankle. Now we'll talk about this in a little bit more depth when we get into our programming and progression section of the video. But the key here is we want to move as far as we can into internal and external rotation, but we're trying and we absolutely must keep the motion to tolerance. That means with a sensitive knee, we're not forcing this into painful positions, but we're also not afraid of a little bit of soreness or achy symptoms. Remember, these are non-weight bearing motions that we're utilizing here. So if a knee is sensitive and swollen and inflamed, it's likely that some of this might cause some ache. We don't want to avoid the motion altogether, but we're going to limit how intensely or how far we're going with this motion to keep it tolerable. Right? So a general rule of thumb is some achy symptoms are perfectly acceptable, but we're not forcing into pain or discomfort. All right, so for this next progression, this is going to be more to target flexion and extension of the knee. So again, we want to start from a supine position. Again, I want my foot to be able to slide back and forth on the floor. So from here, I'm simply going to take my foot. I'm going to extend my leg into extension, hold for a second, and then I'm going to pull my heel in towards my hip as far as I can, trying to create some flexion through the knee. I'm simply going to perform 8 to 10 repetitions back and forth. Now again, as we slide back and forth, you want to use as much range of motion as possible, but we do not want to force the motion. Some mild achy symptoms are acceptable, but these are not no pain, no gain. We're not pushing into pain. We're limiting the motion as needed to keep it tolerable. As I'm going forward, I'm using my quadriceps to tense and extend the knee. Likewise, as I'm pulling my heel towards me, I'm using my hamstrings to guide the motion of the knee and create that bend and create that flexion in the knee itself. Now, just as a side note, performing the exercise from this on our back or supine position is perfectly acceptable. An alternate position is I could perform the same exercise, but just from this floor sitting position. Again, knee extended, or pulling the knee in towards me, sliding the leg back and forth. All right, so for our third and final exercise, again, we're going to target flexion extension of the knee, but this time we're going to change the position of the thigh, and this helps us to target a little bit more of a pull and a stimulus through the hamstring group. So from here, I'm laying on my back, my thigh is vertical. It will typically be more effective if we hold our thigh in this position. That way we keep it in this posture, but we are minimizing tension of the muscles around the hip. From this position, I'm going to slowly extend my leg. I'm going to go as far as I can, but I am not forcing the motion. It should be comfortable and tolerable. Hold for 1 to 2 seconds. I'm going to go slow down. As I get lower, I'm going to try to pull my heel towards my hip to create flexion in the knee. But again, this should be comfortable and tolerable. We're only moving to the point where we're touching some mild symptoms. We are not forcing into pain or discomfort. Slowly up. Hold 1 to 2 seconds. Slowly back down. I'm staying slow and controlled the whole time. We're trying to flush out the joints to create some contract relax cycles through the muscles around the knee. But again, staying within movement tolerance. All right, so now that we've gone over the program itself, let's go over some key programming and progression criteria. First, remember the key with these motions is to move to symptom tolerance. Now, in other words, we want to move as far as possible into each of these directions, but we don't want to force the knee into painful positions that it's simply not ready for or it doesn't feel safe moving into. The balance we're trying to really strike here is that we don't want to avoid these motions altogether, as we know movement can be such a powerful way to influence tissue healing and influence pain, but we also don't want to force the motion and flare up the condition. So the basic rule of thumb here is that mild achy symptoms are okay and can even be beneficial to help deal with the pain response. But we also want to limit the range to that which we can keep tolerable and keep from flaring up the condition. Now remember, when promoting or prescribing these exercises, this is key messaging that we need to explain to patients, especially as some patients will be quite hesitant or maybe even fearful of moving a painful knee, especially if some of these movements do in fact create or reproduce the symptoms as we've been talking about. Now here it's also helpful to point out that these exercises are gentle, non-weight-bearing movements. So any symptoms that they experience will likely be related more to things like tissue inflammation or sensitivity as opposed to tissue damage. And like I said, these are critical things to point out with patients so they understand what the purpose of the exercise is, and they can help to understand what the meaning of the symptoms are if they do experience any with the actual exercises themselves. Now, as far as programming, the typical prescription is going to perform each of these movements for 8 to 10 slow, deliberate repetitions. Remember that slow and deliberate is critical. We don't just want people going through the motions, we want them being attentive and aware and deliberate with what they're doing. And then we're going to repeat this little sequence every few hours. The idea here is that we want to create a light, easy, controllable stimulus, but we want to provide this stimulus on a regular basis throughout the day in order to help guide healing and desensitize the area. Now, the other thing to point out here is that while I do like all three movements as a full routine, it doesn't mean that we necessarily have to prescribe all three movements at once. Depending on the patient and how sensitive the knee is, we can often start with just one or two of the movements and add the other exercises as treatment progresses and their tolerance to the movements and their confidence and trust in the movements improve. All right, so finally, let's talk about progression criteria. Now remember the big picture here, which is that we're trying to build and restore tolerance to these basic fundamental knee motions and knee positions. Here we're looking for the point at which motion is no longer limited by symptoms and the patient is able to tolerate and even push and contract into these end range positions. Now just to clarify here, that doesn't necessarily mean that the motion is completely symptom-free. If the motion is, or the patient demonstrates motion that is, has very mild symptoms, but these symptoms are tolerated and they don't limit the actual motion of the knee itself, we can then progress the exercises. Here, that would typically mean transitioning from a movement routine with a pain tolerance focus to one more focused on knee mobility and knee control.